Hi, everyone, and welcome to episode 12 of Empathic Action. Today, I'm going to be joined by my dear friend, Jason Finucan, who's the author of a fabulous book on mental health. Welcome. I've invited Jason to join today because, as we spoke about yesterday, during this COVID pandemic, I think so many of us are facing mental health challenges, and Jason works in the space of mental health at work. And I think this is a really good time to hear messaging around how organizations and employers can support their employees and what employees need to know for themselves in terms of, keeping their mental health strong while trying to manage work in this COVID world. So Jason, what do you think people need to know?
Well, I think at the very basic level, we all need to improve our mental health literacy. Just the concept of understanding what is mental health and how it exists on a spectrum. We all understand physical health, right? If I say to you, you know what, I've gained 20 pounds and I'm feeling a little bit overweight and I'm not feeling physically healthy, we all understand that I'm not physically at the edge of my health. I'm just a little bit unhealthy and I need to work on it and I can improve. Mental health is very similar. We need to manage our mental health the way we do our physical health with nutrition and things like that. But the other aspect is understanding what mental illnesses even are and how we can experience mental illnesses from a clinical level that has nothing to do with, for example, situations. For me, I was diagnosed in 2005 with bipolar disorder, and there was no trigger. There was no reason that I suddenly experienced the symptoms of bipolar disorder. But right now, we are in a very unique situation across the entire planet, and all of us are being forced to change the way that we live, the way that we work, the way we connect to each other, how little, the amount of time we get of physical contact with those that we love has been radically reduced. All of these things are going to add to our stresses, our anxieties. People might find themselves experiencing depression. And it may not mean that they have or will always have clinical depression. It just may mean that under this stress, the symptoms of that are coming to the fore. So one of the ways that we at StigmaZero try to help anyone who is facing this, but in particular employers, is we offer online training that goes from the initial understanding of what mental health is, what mental illness is, and what stigma is, and why I'm wearing a shirt that says Stigma Fighter, because one of the greatest barriers to addressing mental illness is the stigma of mental illness and the ability to be afraid of what people are going to think and how your colleagues are going to react, or that you might be discriminated against. So we help organizations to train their managers, their HR staff, and their entire employee workforce to understand when mental illness needs to be treated just like any other illness. We don't have stigma towards most illnesses out there. We just have it towards ones that we don't understand or that perhaps we're afraid of. And so that's what our online training program is trying to do. My advice for right now under this particular situation with the COVID-19 pandemic is to remember to take care of yourself, in the sense that what I'm seeing a lot of are people telling me that they are overwhelmed from either trying to work from home when that's not really a good fit for their job, or perhaps their family life because they've got kids running around suddenly who aren't at school. The people who are dealing with financial pressures because of losing a job or being laid off, the overall economic downturn, all of those things, it can be so overwhelming that you can forget to take breaks. You can forget to rest. You can forget to have joy and find joy in different areas maybe of your life that you weren't before. But this is not a time to be stuck in the difficulty of everything that we're facing. We all need to find moments where we come up for air and where we can fulfill our basic needs as human beings. And so I think that's a big part of it is knowing when to ask for help, knowing when to talk to your friends, and knowing when to seek the help of a therapist if need be, which we can do just like you and I are speaking right now through Zoom. I mean, in the era of social distancing, there are many things that still can happen.
So in our final little minute together, I understand that you've put a tool available for free. Could you tell us a little bit about what that tool is and where we can get that access to that?
Yes, absolutely. So at StigmaZero, we asked ourselves, how can we help in the middle of this crisis, and what can we do? And one of the things we realized was that our program contains inside of it about 20 to 40 minutes worth of material that is what we would consider mental health 101. It's the basics of understanding mental health, understanding mental illness, and knowing how to react. And so we put together a special version of our program. We called it Mental Health 101 at Home and in the Workplace. And we are making it free, absolutely free for individuals. Anyone who needs this link, who needs this program, can use the link that I will provide. It'll be in the bottom of your video, and it is absolutely free to go in and log in. And for any employer who likes the content that they see and they'd like to roll that out to their entire workforce, there's ways that you can contact us, and that'll be below as well. But we hope people will use this program as a way to remind themselves to take care of their mental health at this special time.
Well, thank you so much for joining. I know you're super busy, Jason. It was great to speak to you, and thanks to everybody watching, and we'll see you tomorrow.
Lovely to be here. Thank you for having me, Anita.